What if I told you that the leg numbness waking you up at night isn't just something you have to live with, and that the real reason it keeps happening has nothing to do with getting older? I've spent over 2 decades working with patients in their 60s, 70s, and 80s, and one of the most common things I hear, almost word for word, is this. I mentioned it to my doctor, but they said it was just circulation, so I stopped bringing it up.
Right.
And quietly, month after month, the numbness gets more frequent. The sleep gets worse. The mornings feel heavier. Here's what I want you to understand before we go any further. Your body is not failing you. It's been sending a very specific signal, one that has a very specific cause, and tonight I'm going to show you exactly what to do about it. 5 minutes before you lie down. That's all this takes. Before we dive in, if you haven't subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. Point 1. Why leg numbness at night is not just poor circulation. Most people get this completely wrong. And honestly, I don't blame them. For years, the standard explanation for nighttime leg numbness was simple. Your blood isn't moving well, your circulation is slowing down, that's just what happens when you get older. And so people bought compression socks, propped their feet up on pillows, even started taking supplements to thin the blood, all chasing the wrong answer. If that sounds familiar, here's what I want you to understand. Circulation problems and nerve compression feel almost identical from the inside. The tingling, the dead leg sensation, that uncomfortable numbness that wakes you up at 2 in the morning, both causes produce nearly the same symptoms. But the treatment for one does almost nothing for the other. Here's where it gets important. When the numbness comes from nerve compression, specifically pressure on the peroneal nerve that runs along the outside of your knee, or the sciatic nerve that travels through your lower back and hip, no amount of improved circulation is going to fix it. That nerve is being physically pinched, often by your own sleeping position, hour after hour, every single night. And after age 60, nerves don't bounce back the way they used to. Repeated compression, even mild compression, accumulates. What starts as occasional tingling can become persistent numbness that doesn't fully resolve by morning. This is why the distinction matters so much. Before you can treat something, you have to know what you're actually treating. If you've been managing this for months without real improvement, it's very likely because you've been addressing circulation when the real issue is positional nerve pressure. So how do you tell the difference? And more importantly, how do you fix it starting tonight? That's exactly what we're going to get into next. Point number 2. The real culprit. How your sleeping position silently compresses the peroneal nerve. Every single night, nobody tells you this when you leave the hospital, and most doctors don't bring it up during a routine checkup. But the position your body settles into each night may be doing real, cumulative damage to one of the most vulnerable nerves in your leg. The peroneal nerve is a branch of the sciatic nerve that wraps around the outside of your knee just below the fibular head. That small bony bump you can feel on the outer side of your knee. In younger people, a little pressure on that area is uncomfortable but temporary. In people over 60, the protective tissue around that nerve has thinned, the surrounding muscles offer less cushioning, and the nerve itself takes longer to recover from compression. So when you sleep on your side with your knees stacked directly on top of each other, which is one of the most common positions for older adults, that bony surface is pressing directly into the nerve for 5, 6, sometimes 7 hours straight. What makes this so easy to miss is that it doesn't hurt while it's happening. You're asleep. You don't feel the pressure building. You only feel the result. You wake up and your foot is numb, or that familiar tingling is radiating from your knee down to your toes. By morning, it may have eased. You assume it's fine, and then you do the exact same thing the following night. This is a compression injury in slow motion, and the frustrating part is that most people never connect the symptom to the cause because there's no pain at the source, only the consequence downstream. The good news? Once you understand what's causing it, the fix is surprisingly straightforward. And in the next section, I'm going to show you exactly how to stop this from happening, starting with something already on your bed. If you're still watching and finding these insights helpful, please comment number 1 below to let me know you're with me. Now let's move on to point number 3. Point number 3, the blood flow reset, a 90-second gentle ankle sequence that reactivates peripheral circulation before you lie down. I've been practicing medicine for a long time, and if there's one thing I've learned, it's that the simplest interventions are often the ones people skip because they seem too easy to actually work. This is one of them. By the time you're ready for bed, you've likely been sitting for several hours, maybe dinner, some television, reading. What most people don't realize is that prolonged sitting allows blood to pool in the lower legs. The venous pump, the system your calf muscles use to push blood back up toward the heart, goes essentially dormant when you're still. And when you lie down with that sluggish circulation already in place, the combination of reduced blood flow and any positional nerve pressure becomes a recipe for exactly the kind of numbness we've been talking about. This is why what you do in the 2 minutes before you get into bed matters more than most people expect. Sit on the edge of your mattress with both feet flat on the floor. Start by rotating your ankles slowly. 10 full circles clockwise, then 10 counterclockwise each foot. Don't rush it. You're not exercising, you're waking up the vascular system. Then shift to toe raises. Keep your heels on the ground and lift your toes toward your shins. Hold for 2 seconds, lower slowly. Do this 10 times. Finish with heel raises. Toes down, lift your heels, squeeze your calves gently at the top. 10 repetitions. The entire sequence takes under 90 seconds. What you're doing is manually activating the calf muscle pump, clearing pooled blood from the lower extremities before your body goes horizontal. Less pooling means less pressure on already compressed nerves. The effect is immediate and cumulative. The more consistently you do this, the better your legs respond overnight. And here's where it gets even more interesting, because the position you move into right after this sequence is just as important as the sequence itself. That's what we're covering next. Point number 4, pillow placement, the one positional change that reduces nerve compression by up to 60% while you sleep. You've already done the ankle sequence. Your circulation is moving, and now you're about to undo all of it because of how you position your legs the moment you lie down. Here's something that surprises a lot of my patients when I explain it. The human hip is not designed to stay stacked for hours at a time. When you lie on your side and your top knee drops forward and down onto the lower leg, your entire pelvis rotates slightly inward. That rotation creates a chain reaction. It shortens the piriformis muscle in your hip, which tightens around the sciatic nerve, which increases tension all the way down to the peroneal branch at your knee. You've essentially recreated the same compression problem from a completely different angle, and you're holding that position for the entire night. The fix is a standard bed pillow placed between your knees. Not under them, between them. The goal is to keep your hips level, your knees separated, and your spine in a neutral position. When your top knee has something to rest on rather than dropping inward, the rotational pressure on your hip and lower back disappears. The sciatic nerve has room to breathe. The peroneal nerve at the knee is no longer caught between two hard surfaces, pressing together under your body weight. For back sleepers, the adjustment is slightly different. Place a pillow under your knees, not flat under the legs, but directly beneath the knee joint, so your legs rest in a gentle bend rather than lying completely flat. A fully extended knee on a firm mattress can compress the popliteal vessels behind the joint, reducing circulation to the lower leg through the night. Neither of these requires a special orthopedic pillow. The one you already have works fine. Now, there are also things happening in your kitchen before bed that are quietly making this worse. And most people have no idea. That's exactly what we're talking about next. Point number 5. The 3 foods to avoid after 6 p.m. and why they're silently causing vascular constriction in your legs overnight. Let me ask you something. Have you ever had a night where you did everything right, good position, pillow between your knees, even did the ankle sequence, and your legs still woke you up? There's a good chance the answer was already in your stomach before you ever got into bed. The first is high-sodium food. Most Americans over 60 are consuming far more sodium than they realize, not from the salt shaker, but from canned soups, deli meats, frozen dinners, and even bread. When sodium levels spike in the evening, your body retains fluid to try to balance it. That fluid doesn't distribute evenly. It settles in the lower extremities, increasing pressure in the tissue surrounding peripheral nerves and vessels. The legs feel heavier, the nerves feel more compressed, and the whole system is working against you before you close your eyes. The second is alcohol. Many people believe a glass of wine before bed helps them relax and sleep better. And initially, it does dilate blood vessels. But within 2 to 3 hours, right in the middle of your sleep cycle, alcohol triggers a rebound vasoconstriction. The vessels that opened up now clamp down, peripheral circulation drops, and that's precisely when the numbness tends to hit. The third is caffeine, and this one catches people off guard because they stopped drinking coffee at noon. What they didn't account for is the half-life. Caffeine stays active in your system for 6 to 8 hours. A 2 p.m. cup of coffee still has meaningful stimulant activity at 8 p.m., keeping your sympathetic nervous system slightly elevated, your peripheral vessels slightly constricted, and your legs slightly deprived of the circulation they need overnight. Cutting all three after 6 p.m. costs nothing, and the difference in how your legs feel by morning can be significant. But what you drink matters just as much as what you eat, and the timing of your water intake is something almost nobody gets right. That's next. Point number 6. Hydration timing. Why drinking water wrong before bed actually worsens leg numbness, and the right window. This one is going to feel counterintuitive, because everything you've been told about staying healthy says drink more water, and that advice is correct, but timing turns good hydration into a problem nobody warned you about. Here's what happens when you drink a large glass of water right before bed. Your kidneys, which slow down their filtration rate during sleep to let your body rest, suddenly have a volume of fluid to process at the wrong time. For adults over 60, the bladder's capacity is naturally decreased, and the urge to urinate becomes harder to ignore. So instead of completing a full 90-minute sleep cycle, which is when your nervous system does its deepest repair work, you're waking up once, sometimes twice, to use the bathroom. Each interruption pulls you out of the restorative sleep stage. And here's what most people miss. It's not just the broken sleep that worsens leg numbness. Every time you get up at night, your legs go from horizontal to vertical. Blood pressure shifts suddenly, and peripheral circulation has to restart from near zero. For someone whose peroneal nerve is already sensitized from compression, that repeated vascular disruption amplifies the numbness that follows. The fix isn't to drink less water overall, it's to drink it earlier. Aim to get the majority of your daily fluid intake, roughly 60 to 70% of it, between late morning and 5 p.m. This keeps your body well hydrated through the evening without forcing your kidneys to work overnight. After 7 p.m., small sips are fine if you're thirsty. A full glass is not. Proper hydration during the day also keeps the myelin sheath, the protective coating around your peripheral nerves, better maintained, which directly reduces nighttime nerve sensitivity. You've now addressed circulation, position, diet, and hydration. But there's still one piece most people never try: a specific 2-minute stretch that works directly on the nerve itself, and it changes things faster than almost anything else in this routine. If you're still watching and finding these insights valuable, please comment number 1 below to let me know you're here. Point 7. The 2-minute nerve gliding stretch that most doctors never teach, and why it works specifically for seniors. Think about a garden hose that's been kinked in the same spot every day for years. Even when you straighten it out, it doesn't flow freely right away. The kink has left a memory in the material. Your peripheral nerves work in a remarkably similar way, and this stretch is how you begin to undo that. Nerve gliding, sometimes called neuromobilization, is a technique that's been well documented in physical therapy literature for decades. But it almost never makes it into a standard doctor's appointment, partly because it takes time to teach properly and partly because most physicians aren't trained in it. What it does is gently move the nerve through its natural anatomical pathway, restoring mobility along the entire length of the nerve rather than just stretching the muscle around it. For seniors specifically, this matters because the connective tissue surrounding aging nerves becomes less pliable over time. The nerve loses its ability to slide and adapt freely as your leg moves. Compression builds up not just from outside pressure, but from the nerve's own restricted mobility. Here is exactly how to do it. Sit upright on the edge of your bed or a firm chair. Straighten one leg out in front of you as fully as comfortable, then slowly flex your foot, toes pulled back towards your shin. Hold that position for 5 seconds, then release. Lower your leg back down slowly. That's 1 repetition. Do 5 on each side, alternating, breathing steadily throughout. The entire sequence takes under 2 minutes. You should feel a mild pulling sensation along the back of the leg or behind the knee. That is, the nerve mobilizing. If you feel sharp pain or electric shooting sensations, stop immediately and consult your physician before continuing. Done consistently each evening before bed, most people notice a meaningful reduction in morning numbness within 7 to 10 days. Now you have every individual piece. What remains is putting them together in exactly the right order, so that 5 minutes before bed becomes the most effective thing you do for your legs all day. That's what we're building right now. Point 8. Putting it all together. The exact 5-minute pre-sleep routine, step by step in order, starting tonight. You've made it through everything, the science, the causes, the individual fixes. And I want to be honest with you, most people who watch a video like this will understand it completely, feel genuinely motivated, and then go to bed doing exactly what they've always done. Not because they don't care, because nobody gave them a single clear routine they could follow without having to remember 7 different things at once. So that's what I'm giving you right now. Start while you're still sitting up on the edge of your bed. Run through the ankle sequence first. 10 circles each direction, 10 toe raises, 10 heel raises, 90 seconds. This is your circulation reset, and it has to happen before you lie down, not after. While you're still seated, move directly into the nerve gliding stretch. 5 slow repetitions on each side, foot flexed, hold 5 seconds, release. Don't rush this part, 2 minutes total. By the time you finish, your peripheral circulation is active and your sciatic nerve has been gently mobilized through its full range. Now adjust your position before you settle in. If you sleep on your side, place a pillow between your knees before your head hits the pillow. Not after you've already gotten comfortable, because you won't move it. If you sleep on your back, slide a pillow under your knees so your legs rest in a slight bend. Take 15 seconds and do this deliberately. That's the entire routine. 4.5 minutes on a consistent night. The other half of the equation, the foods, the hydration window, the caffeine cutoff, those aren't part of the bedtime routine itself. They happen earlier in the evening and become habits over time, not tasks you manage at 10 p.m. What matters most is that you begin tonight. Not with perfection, with the ankle sequence, just that one piece, because a body that gets consistent, gentle attention before sleep responds. And at 60, 70, even 80 years old, that response is still very much within reach. Important medical warning. Before we close, I need to say something directly, and I need you to take it seriously. Everything in this video is designed for the kind of leg numbness that builds gradually, follows a pattern, and is clearly connected to sleep position or lifestyle habits. That is a manageable, addressable problem. But there is another kind of numbness that is not. And knowing the difference could save your life. If you wake up and one leg is suddenly numb in a way that feels completely unfamiliar, not the slow tingle you've had for months, but abrupt, alarming, and different, pay attention to what else is happening in your body. Numbness that arrives alongside facial drooping, arm weakness, sudden confusion, or difficulty speaking is a stroke until proven otherwise. Call 911 immediately. Do not wait to see if it passes. If your calf is swollen, tender to the touch, and warm, especially after a long period of sitting or travel, that is a possible deep vein thrombosis. This is a blood clot and it requires same-day emergency evaluation, not a home remedy. Chest pain with any leg symptom. Sudden one-sided weakness that doesn't resolve within minutes. Numbness spreading upward rather than staying localized. These are not situations for a bedtime routine. These are situations for an emergency room. The 5-minute routine I've shared with you tonight is real. It's evidence-based and it works, but only when the underlying cause is what we've been discussing. Your job is to know which category you're in. If you are ever unsure, err on the side of calling your doctor. That is never the wrong decision. Your body is still listening. The question is whether you are. We've covered a lot tonight, but I want to leave you with something that goes beyond ankle sequences and pillow placement. After 60, the body doesn't give you dramatic warnings the way it did when you were younger. It doesn't shut down overnight. What it does is accumulate, quietly, gradually, in ways that feel easy to dismiss. A little more numbness this month than last. A little less sleep. A little more fatigue by noon. None of it feels urgent on its own. But 5 years of ignoring small signals has a way of becoming a much larger problem that's significantly harder to reverse. That's the honest medical reality. And I'm not telling you that to frighten you, I'm telling you because the other side of that truth is equally real. 5 years of small, consistent choices, the right sleep position, the right evening habits, 5 minutes of intentional movement before bed, compounds just as quietly in the opposite direction. Better sleep, steadier balance, a body that feels more like yours again. You earned that. At this stage of life, you deserve to wake up rested, to move through your day without your legs reminding you of every hour you slept wrong. The routine is simple, the science is solid, and tonight is as good a place to start as any. If you enjoyed this video, please leave a comment with 1. If not, feel free to comment with 0. Your feedback means a lot to us. Don't forget to like, share, and subscribe to our YouTube channel for more content like this. Thank you for watching, and here's to living life on your own terms.